Hello everyone, my name is Miss Stephanie and I am the Social Services Librarian at Willard Library. My role is to be the liaison to community social services expert partners. Our staff does an amazing job trying to give resources when people come to our libraries. However, we are aware due to time restraints and trying to make sure we are available to all of our guests, we're not always able to give the time, the additional resources that we would like to. And so that is where I come in. As a social services librarian, I will do my very best to try to find the resources that you need. I am available on Mondays 1 to 4 and Thursdays 9 to 1, and I alternate between the two libraries, Helen Warner Branch and Downtown Willard Library. If you have some questions in regards to social services, please give me a call at 269-968-8166 extension 501, or please contact me via email sboyd@willardlibrary.org, or feel free to call the reference desk and they will know how to contact me. We are so excited to be able to offer this additional resource for you. We also have some exciting news as an additional resource. We are going to offer Let's Talk About It at Willard Library virtual resource. And what this program will do is we will contact different organizations throughout the community and through Calhoun County to come and interview them, talk to them about services that are available that not many people may know about. And that will be aired every first Thursday of the month at 6:30. So if you don't have an opportunity to watch it every first Thursday at 6:30, we will have it on our website. We are so excited to offer this resource program for you. It's not counseling. What it is offering you different resources that that could be helpful for your needs. So that being said, let's get started with our first organization, Summit Pointe. Well, hello everyone. This is Miss Stephanie, and today for our very first Let's Talk About It at Willard Library, we have some of the faces of Summit Pointe because our topic today is mental health. So I'm so excited to have each and everyone here today, and we believe that the information that you will receive today will be very helpful, if even not for you, but for someone else. And just a reminder, we will air every first Thursday of the month at 6:30. So we're going to go ahead and get started. Today we have, again, the faces of Summit Pointe. Our first guest is Megan. So Megan, can you tell us a little bit about Summit Pointe?
I can. So Summit Pointe is the community mental health provider in Calhoun County, which means that we provide behavioral health services. So that can mean both mental health services and or substance use services for residents of Calhoun County. And so we offer quite a wide variety of services available to include services for adults, youth services, crisis-based services, case management, community-based services, outpatient, and also medical services, so seeing psychiatrists, for example. We have really expanded even some of those services that we offer since opening our First Step Psychiatric Urgent Care program, which I know Lakita will talk a bit more about But really, we hope that Summit Pointe is just a no wrong door entry for folks looking to access behavioral health care. All too often that we know navigating a behavioral health system can be difficult, and as I said, I just listed a lot of different resources. People sometimes don't know, like, well, which one do I need, or which one might be most beneficial. And so we want to help you in that, and we want to help you be able to figure out how do we support you in your journey to recovery, whatever that may look like.
I love it. And I know Lakita will be talking about First Step. However, in regards to Summit Pointe, what would be the first step for someone contacting Summit Pointe if they don't want to go to First Step?
Sure, yeah.
That's
right.
a mouthful.
It is. So we have a main number, 269-966-1460, and they will, you will talk to somebody on that line who kind of helps figure out and triage where do you need to go within our system. Having First Step really is advantageous or a benefit to our community because you can walk in at any time, and so. But again, you can also call. Any of our services now are available 24 hours, so that people can access that whenever is most convenient to them. In addition, I was going to say too. Families can also call us if you have a loved one who is struggling and you're just not sure. Where do I turn? What do I do? And Lakita seems a part of that as well. But helping families really navigate a system to say, this is the most appropriate avenue to getting your loved one help can start with that phone call as well.
I love it. And by me also being a youth librarian, do you have a area that focuses just for children?
Yes. Again, quite a service array for youth and families. I think one of our most beneficial or maybe most utilized is our ICS, our Intensive Crisis Stabilization team, or sometimes commonly referred to as our Youth Mobile Crisis Team. That is a team that is available 24 hours a day. They respond in teams out in the community, to homes, to schools, and that is really a service that is the need for a crisis is defined by the youth and the family. So it could be anything from having a kiddo who doesn't want to go to school that day to things that are more severe. So they service anyone in Calhoun County ages 0 to 21 with that program, and that phone number is 269-441-5945. And again, clinicians that will come to wherever the crisis may be occurring.
All right. Wow. That is a wealth of information. Thank you. So Lakita, thank you for being here. Can you tell us about First Step?
Absolutely. So First Step is just that. It is the first step to connecting to any of our services. And the benefit, as Megan spoke about, to First Step is that it's a 24-hour facility, 7 days a week. So at any point, at any time, whether it's a routine service that you're looking for just to get engaged in therapy, medication services, or in the event an active crisis is going on, anyone can walk into the First Step building and get access to either a clinician, a recovery coach, peer support staff, any clinician. We have a wide variety of folks that house that hub, and so at any given point, they will then triage what services, what needs is most beneficial to the person coming in for services. And so again, it's open to anyone, even outside of Calhoun County.
Wow.
However, as we get into the meat of what's really going on, a lot of times they will get them back connected to their county of origin where they belong, whether, that's a surrounding Coldwater, Kalamazoo area. They will then help get them connected back to that service. However, in the event it's a crisis, an emergent situation, we will service that person right then and there to meet their needs.
Wow. Is there a charge for your services?
So that's kind of twofold. There's no active charge for someone seeking crisis services. However, all of that information is obtained at some point during services. If you have insurance, if you don't have insurance, they can also connect you to and help assist applying for Medicaid coverage. If you have a private insurance or Medicare, they can help you call, find out what services you do have available to you, and get you connected to those as well. So initially, no, there's no charge to come in, walk in, and be served. However, there may be a charge occurred somewhat after that.
Okay. Can you give us the address and the telephone number?
Absolutely. So the address for our first step is 175 College Street, located here in Battle Creek. Anyone who is from the Battle Creek area, that is the old regional medical lab. So we still have people walk in and think they're getting blood work done, and we have to redirect them to Bronson Battle Creek, but that is where we are now located. That phone number is also the same as our universal number, 269-966-1460. But you could also access the 24-hour crisis line, and that number is 1-800, oh, I better look it up so I don't give the wrong number out. I want to make sure I give the right, I'm sorry.
Okay, I appreciate that. And you can always contact the library. We will have that information available as well, as far as the telephone number and the address. And if you're just tuning in, my name is Miss Stephanie from Willard Library. I am the Social Services and Youth Librarian. And today, for Let's Talk About It at Willard Library, our topic is mental health. And so Lakita is going to give us the 1-800 number to First Step.
Yep, that's 1-800-632-5449.
Thank you. So to my right is Scott. And Scott, can you tell us your role through Summit Pointe?
Yeah, so I am the suicide prevention facilitator at Summit Pointe, and my role is really to lead our community-wide work, county-wide work of the Suicide Prevention Coalition of Calhoun County. So that is really an open membership coalition that we have representatives all throughout the county, of people that get together that have a focus, that have a passion, a drive to prevent suicide in Calhoun County. So including behavioral health providers like Summit Pointe, but we also have members in our organization from organizations like Willard Library, as well as educators, people in medical health fields, law enforcement, nonprofit and private sector. So part of that community work, we have a strategic plan that kind of drives what we're going to be focusing on and working on. One of the most important pieces is increasing education and awareness of suicide prevention, letting community members know that it's not just a matter that should be left up to behavioral health professionals. It's really, suicide prevention is the responsibility of the entire community. So with that thought, one of the most important things that we are trying to do is train as many people in the county in what is, it's a training called QPR. So QPR, it stands for Question, Persuade, Refer. It is the 3 steps to help somebody who might be in a suicidal crisis. So the acronym was chosen very deliberately to kind of parallel CPR. So in the same way that CPR is a bystander intervention, individuals in the community are trained to recognize warning signs of cardiac crisis, and once they recognize those signs, that's their cue to immediately step in and apply CPR until professional medical supports can also provide life-saving support. So QPR operates in the same way. So it's meant to train our community members. What are the warnings? First, just because of general information about suicide, the nature of suicide and suicide prevention, but really training community members to recognize the warning signs of a suicide crisis, and then not just recognizing those, but knowing that that means I have to do something. That means that I have to, when I see those signs, I need to move into action. And that's where the other steps come in of QPR, Question, Persuade, Refer. The refer piece, much in the same way as somebody providing CPR until medical supports come in, that refer piece is really important. So not just providing support to somebody that's in your life, but getting them connected to professional support, such as Summit Pointe or other behavioral health providers in the community. So that's one of the biggest things that we're doing. We're also trying to just increase supports for any community members that have been impacted by suicide. So that does include people who have already lost loved ones to suicide. One of the key components of suicide prevention is what's called postvention, which is really prevention, but that is applied after somebody has died. So you're getting supports for the people that have been impacted by that. We also are going to be increasing supports for people that struggle with thoughts of suicide, as well as individuals who are suicide attempt survivors. Myself, I am actually a suicide attempt survivor, and one of the things that we're going to be looking to do is starting a support group for suicide attempt survivors. But even before, that's going to be kind of a longer term goal. Currently, we're also going to be starting a support group for survivors of suicide loss.
Wow.
And we actually, Stephanie, as you know, you will be one of the group's facilitators.
Mm-hmm.
We are having our facilitators are having our training today.
Mm-hmm.
So we'll have a total of 5 facilitators that will be able to lead this countywide group, supporting those who have been bereaved, who have lost somebody to suicide already. So those are some of the things that we'll be doing throughout the community.
That's awesome. And I love how you shared how you are a suicide attempt survivor. Is that the best way to say it?
That's the phrase I use.
Okay.
Yep.
And how you're turning your pain into purpose, and that you're reaching out to see what we can do as gatekeepers to prevent others that may be feeling that way. So tell me a little bit about the Lunch and Learn. I know that you offer QPR Lunch and Learn. Tell the community how they can get involved in that.
So that QPR training, we just at the end of last year trained a team of 10 additional QPR instructors. So we have a team that's ready to go. So we can go to organizations, workplaces, schools, really anywhere in the community to provide this training for free. But we're also offering this virtually on a monthly basis. It's the third Thursday of each month from noon to 1. And the easiest way to access that, the online registration, is through Eventbrite. So going back to Suicide Prevention Coalition of Calhoun County, we use the acronym SPCCC, that's 3 C's. So the easiest way for somebody to register for our monthly online training would be to go to spccc.eventbrite.com.
Wow. Well, thank you for sharing that information. So let's talk about a little bit about the stigma and the myths that go behind mental health and suicide. So let's start out with mental health, which they all kind of go together. When do you think a person should, we have our bad days. We also have days where I call them stinking thinking, where we just can't get past the negative thoughts that go through our mind. When do you believe a person should go forward in contacting Summit Health or suicide prevention?
So I always think it's a really easy kind of rule of thumb to say, when your symptoms, whatever they may be, your feelings of sadness, your crying spells, your difficulty getting out of bed, whatever that looks like for you, really starts to impact your ability to live, laugh, and love. It's just a really simple way to think about it, right? But clinically, we say things like impacting your ability to function. Can you not go to work? Can you not take care of yourself? Showering, bathing has become extremely difficult. Are you neglecting other responsibilities? When are we reaching a point where those symptoms become so significant that I can't function? So that's always a really great red flag to come into us. We'd also like to see it before it becomes a crisis. I think before people maybe reach a point where it becomes so significant in their life. But when they start to look at what are some of these symptoms I'm starting to experience, man, they're really difficult. You may just don't have the skills to manage appropriately. I'm feeling like, some of the things I've tried in the past aren't helping. Those are really great kind of red flags to say, I just need some supports in this.
Why do we believe that people, even when they get to that point, they are hesitant in reaching out for help?
I think that a lot of times it comes back to their upbringing, their knowledge of mental health. Some cultures, some family structures don't acknowledge mental health as something real. And so it's a lack of understanding Sometimes it's fear, driven by fear. And sometimes, again, just the lack of knowledge of what to do or who to reach out to, or the feeling of feeling vulnerable. And I think that's, to kind of piggyback on what Megan was saying, I think it's equally important to recognize those things in people who we're close with as well, who you have connections to, because when people get to those points, there are some who won't reach out for help and who might get caught in, those feelings of hopelessness and helplessness and not be willing to reach out for help for themselves. And so that's one of the things that First Step can also help with our team of crisis clinicians, is when you have individuals who you're connected to, who have really reached a point where they're not doing well, they're not reaching out for help, they're not managing themselves as they once did, they're not getting out, they're not showering, they're not eating properly, or they're drinking themselves, under the table, or using other drugs to kind of alleviate or self-medicate. We can petition individuals. As a family member, you can reach out to find out what that process is, and that starts at First Step as well, to find out if they've met that criteria where they're not doing it for themselves, and we need to intervene to avoid them reaching to the point of, a suicide attempt or completion.
So Scott, what are some of the myths that people may have as it relates to suicide?
There are a lot of myths, I think, that are kind of out there in the culture. The biggest one, the number one myth that I think is important to break down, is the myth that talking to somebody about suicide, asking them if they're having thoughts of suicide, that the myth that that's going to put that thought in their head. Many times, what we know is that after people have attempted suicide or even died by suicide, many times the loved ones, the people in their lives, looking back, could recognize that there was something going on, that there was something wrong. Unfortunately, very often, those individuals didn't get the support they needed, because those warning signs were there, they were recognized, but there can be a lot of fear in the people around that individual in reaching out, or even something as simple as finding out if they're having thoughts of suicide, because we're very often afraid, of offending that person, or if they're not having thoughts of suicide, did we just put that thought in their head, which is completely untrue, or just fear that we're going to say the wrong thing, that we're going to do the wrong thing, which unfortunately leads us very often to avoid providing support, which the person in pain is essentially very often met with silence. So that's the number one myth that I think we really need to break down and have an understanding about.
Thank you for sharing that. So we do know that unfortunately there will be people that will choose not to seek out professional help. So I was wondering if there could be some helpful tips that you all could kind of share with our listeners. If you do feel as though you are struggling and you just for some reason do not feel like going to seek professional help, what are some tips that we could give them to help them get through some tough times?
Yeah, so I can think of, Scott said it earlier in terms of suicide prevention being a community approach, and I really think that is a great way to look at how we support behavioral health as a whole, right? And so I think it's all of our responsibilities to work on stigma and really make it a safe and comfortable place for people, as we would medical care, right? For people to seek behavioral health treatment. We know that not everyone comes through our doors who may need to come through our doors. And so I think it's really important, that we're supportive, that we're a listening ear. I'll also say, there, as Scott talked about, QPR for suicide prevention. There is mental health first aid, which is also a similar training. It's an 8-hour training really dedicated for just a lay individual to learn more about signs and symptoms of mental illness and things that they can do that are helpful or not so helpful. That's another resource that we provide at Summit Pointe. In addition, I think it's being support And then knowing, as Lakita talked to, if somebody's really reaching a threshold that is putting them at some significant risk, that you are able to call and you know what your resources are in those instances.
Anyone else?
No, I think Megan covered it. I think in terms of skills or basic skills that people can do, I always offer individuals I speak with to get on YouTube. We're using the internet a lot to get on YouTube and look up mindfulness. So there's a lot of different mindfulness exercises, and you don't have to be an expert or a therapist yourself to navigate through some of those, but things simple as nature sounds, things to relax you, going out for a walk. We know we live in Michigan, we don't have a lot of sunlight, so a lot of us are naturally vitamin D deficient, so increasing vitamin D or getting a full medical workup to make sure you're not deficient in those areas, but adding in a multivitamin, getting out, taking those walks, maybe finding a hobby, whether that's scrapbooking or taking pictures or even if it's crossword puzzles, just doing something to occupy your time, because sometimes you spend a lot of time in your head and your thoughts and you get wrapped up in that. And so if you're already having a bad day and you're spending the majority of your time alone, that could be detrimental to your mental health as well as your physical health. But being intentional about getting out and trying to make connections and do things differently. And if those things don't work, I always tell people, when you get to a point where you've tried everything that you can within your power, that's the point where you then reach out for some more professional help.
Thank you. And of course, Willard Library, if you would like to come and check out some of our resources, we have, obviously we have books. However, we also have Hoopla, we have Libby, we have ways that you can download things on your phone or through your laptop or your computer. We have resources if you just want to do self-care through reading. We have things about mindfulness. We have things where you can research more about your diet, things. If you have been diagnosed with something, we usually have books about that. If not, we'll do our best to try to order something. Everything that you borrow from Willard Library is free. If you would like to get a library card, come to either one of our locations and bring us an ID that shows that you are a resident here in our 4 districts. We'll see whatever we can do to get you a card. If you have fines that you are concerned about, just give us a call so we can see what we can do to allow Willard Library to be one more resource that you can use. Our number is 269-968-8166. Our reference extension is 513, and my extension is 501. Again, my name is Miss Stephanie. I can't pretend that I have all the answers, because I don't. However, this is why we are doing something like this. We are trying to connect with our partners in the community and the county so that they can let you know that these resources are available. We want to do whatever we can to work together to connect and help one another. Does anyone else have anything they want to share?
I did think of, one more resource that we also have on our website. It's called Credible Mind, and it's also just a great hub of podcasts, self-assessments, videos, any way that maybe you learn best. That's a completely free resource if you visit our website, and confidential. So you can go on there and make a profile and have really anything at your fingertips on any topic that you could really possibly think of that may be helpful. So
That's awesome.
another one, sorry.
And I can think of one more thought, especially given I'm somebody who, I work in behavioral health, but I've been on, been in the other set of shoes of I have received behavioral health services. I know what it's like to struggle with mental health conditions. So the biggest thing I would say for anybody that's struggling in the ways that we talked about as far as your daily life being impacted, but you're not sure whether you want to reach out for help, or if you're seeing that in somebody else and not sure how to help them. I would, as far as breaking down the stigma, I would really go back to just the thinking about the mind-body connection. You know, if I had a pain in my foot that was really inhibited me from walking and getting about throughout my daily life, throughout the community, I'd probably eventually do something about it. So it's difficult because emotions, thoughts, behaviors are complex, whereas, you know, mobility seems a little bit more straightforward, but just remember the brain is a part of the body. And sometimes I have to repeat that refrain to myself repeatedly. You know, the brain is part of the body, the brain is part of the body, the brain is part of the body. We need to take care of all of us, the whole person.
Thank you, Scott. And again, if you're just tuning in, our topic is mental health. And we have some of the faces of Summit Pointe, and just bring up some of the stigma that we talked about. One more question that I thought about. I know in the African American community, there was a stigma. I think it's getting better about reaching out for help. However, that's not the only culture that may have a fear of reaching out. And so I know that Summit Pointe offers different help for different types of culture. Can any of you speak to that?
I don't know if it's specified the help that we offer by culture, but we certainly try to meet all of our customers where they're at. And we had an influx of Burmese population in the community over the last several years. And most recently, we have some individuals from the Congo who have migrated here to our community and plan on living here. And so there's, you know, a team of people kind of meeting on a regular basis to try to make sure we're meeting their needs. There's a lot of language barriers. There's things that they, you know, need access to that they can't properly communicate. And so in either of those scenarios and any others, if there's a language barrier, a culture barrier, you know, we have resources and other ties to community partners to make sure we have interpreters available to make sure that they are getting the help that they need. And sometimes, you know, we face, especially in crisis situations, with those cultural differences, not everyone recognizes what's going on as a, you know, a mental health crisis. It could be cultural. And so being able to be well versed in that is something I think that as social workers we stride in, and things that we have to talk about and stay up on and refreshed on, because we're not going to know everything that we approach. And being able to recognize, you know, is somebody avoiding eye contact because they're scared or fearful, or is that a part of their culture and they're not going to look me in my eyes? And, you know, being able to recognize some of those different signs. So I wouldn't say that we have specifics to each different culture, but universally I think we do our best to maximize and meet individuals no matter what walk of life they're coming from, where they're at.
That's good. The other question I have, and then it'll be time for us to stop, is we see a lot of people that come in that struggle with addictions. What services do you all offer for that?
So some of the individuals that we employ at Summit Pointe, which I think consistently I say are some of our most valuable staff, are what we call recovery coaches. And those are individuals who have lived experience and are in recovery themselves. So at least 2 years of recovery to be in a position. I think oftentimes what we see with individuals struggling with substance use disorder is some ambivalence about getting treatment, right? And it's scary. It can be very scary because physically they may go through some changes, emotionally, right? This may have been a tool of coping for them. And so someone like a recovery coach who has been through the journey, maybe tried varieties of different treatment, be it inpatient, community-based, outpatient, who can really relate to them on a different level, it's a really valuable resource that we have, and they are an amazing team of individuals. So with a very diverse team of individuals, and I think it's important to say different genders and cultures and drug use histories, and you know that's all very important as they have conversations with individuals. So they are stationed at our first step location as well. And so sometimes it's, you know, just coming in and asking to speak to a recovery coach. What are my options? And really they're looking at how do we have a recovery plan that's specific to you. Not everybody's is going to look the same. And so, you know, I think that's just a very valuable substance use resource we have. In addition, we have others from outpatient, individual treatment, group therapy, IOP, intensive outpatient. Yeah, opioid health home is another specific to opioid dependence disorder. But again, a gamut, but I think it really starts with those conversations with our coaches.
Okay. So, once again, this is Let's Talk About It at Willard Library. The first topic was mental health. We have some of the faces of Summit Pointe. I thank each and every one of you for being here today. I hope that this resource will be helpful to you or to someone else. Please share. Once this is aired, we encourage you to share with someone else that may need this information. We will be doing this every first Thursday of the month at 6:30, and then it will be available on our website and some of our other social media websites. And so thanks again. Thank you, Summit Pointe. I am just excited and honored that you all were able to take time out to come and help our community. I believe this was a wealth of information, and that we're going to, it just takes one day at a time to make a change. So thanks again.
Thank you.
Thank you.